The Health Ministry is stepping up measures against the mysterious Wuhan virus. All patients at emergency departments will be screened, and those with fever and travel history are isolated. On Monday, China confirmed that the virus has started spreading from human to human. Since January 4th, there have been 7 suspected cases in Singapore. All have tested negative for the virus. The Straits Times visited the National Centre for Infectious Diseases to see how it manages suspected cases.
This is still a very, very new virus. We know that it is one of the coronavirus that is within the coronavirus family. Very likely the transmissions will be very similar to many of the other coronavirus, where we have to take care of droplet transmissions, maybe sometimes airborne transmissions, as well as contact transmission.
Individuals suspected of being infected will be isolated. Medical staff are clad in full personal protective equipment so they will not be exposed to viruses. The NCID has 330 beds, including 124 negative pressure isolation rooms, where air flows only into the rooms, not out of them.
Patients will go through a clinical assessment as well as laboratory assessment. The purpose is for us to identify whether or not it is due to the novel coronavirus, or it could be due to any other very common viruses in circulations that can give rise to acute respiratory illness.
MOH has urged the public to remain vigilant and to adopt good personal hygiene practices.
Avoid crowded area, and if you need to step out of your house, good to put on a surgical mask, wash hands very frequently, do good hand hygiene, as well as to always update their vaccinations, for example, influenza vaccinations. If they need to travel, pay specific attentions to the area that they will be traveling, and of course avoid some of the at-risk area, for example, very crowded area, or the market area, or potentially come into contact with live animal or poultry markets.